Good morning, everyone. My name is Bill Robinson, and I'm the CEO of ADA Practice Transitions. And I want to welcome you to this morning's webinar, Staff Management During Transitions. Before we start, let's begin with a few housekeeping items. So first of all, the webinar is being recorded, and it will be available afterwards through a link on our website and on our blog. There is CE credit offered for this course, but it is only for those who are attending the webinar live. For those who download it and view it afterwards, they cannot get the CE credit, but you will be sent instructions. If you're here at the event live, you'll be sent instructions about how to collect that credit either next week or shortly thereafter. If you have a question during the presentation, if you haven't used Zoom before, if you look down in the bottom banner on the bottom of your screen, there's a little box that says Q&A. And that's where we would like you to put your questions and put them in as they come up throughout the webinar. If we're able to, we will answer that question in real time. If not, we'll hold it off until the end of the session for the Q&A section. Or if we can't get to all of the questions, rest assured we will deal with all of them and we'll send you an answer afterwards. So, in fact, I would like to start with a question that we hear frequently as we talk to the dentists who are on our platform. We're often asked, when do I tell my staff what I'm doing? Do I wait until everything is done, or do I let them know early in the process? There are two wildly different opinions about what to do about this. On one side, some folks think that it's best to keep everything quiet until all of the deals are complete, whether you're selling a practice or hiring an associate. There's this concern that telling people about this change, the staff will leave, or patients will leave, or competitors will take advantage. And all of those things are possible, and they should be considered. There is another side, or a different opinion, that says that it's best to tell your staff and maybe even your patients early on about what your plans are, and to the extent that it's appropriate, to include them in that process, especially communicating to them. It can be very unsettling to the staff, as you can imagine, if they just come in one day and then they find out that the ownership of the practice is changing, or that a new dentist is coming in and they've heard nothing about this prior to the event happening. Here at ADA Practice Transitions, we tend to favor that second opinion a lot more. We like that transparency, that communication, and what we've seen in talking with dentists about the transitions that they've been through is that communicating with staff throughout the process is key to a successful transition. In some cases, it turns out to be one of the most important factors in making the transition go smoothly. And I think you'll understand that a little bit more when you hear our presenters talk today. They'll address that as well. If you'd like more on this particular topic, I would encourage you to go to our blog. There is a blog post on the website called "Shh, I'm Selling My Dental Practice." And that will give you some background into why we feel the way we do about how important it is to share some of that information. So without further ado, let's get to the meat of our topic today, and I'd like to introduce our presenters. First, I want to introduce Dr. Suzanne Ebert, who graduated from the University of Louisville College of Dentistry. In 2000, she started her solo private practice in Ponte Verde Beach, Florida. And then upon the sale of her practice, she continued her career providing dental care to indigent populations by becoming the dental director at a local federally qualified health center. She is an adjunct faculty for the University of Florida, or when she was adjunct faculty for the University of Florida, she worked directly with senior dental students as they rotated through her clinics. She considers herself a clinical dentist first and is unwavering in her desire to support private practice dentistry. She's currently the Vice President of Dental Practice and Relationship Management for ADA Business Innovations Group, and she gets a lot of credit for the ADAPT platform as it exists today. So I work very closely with Suzanne and appreciate her work every day. Joining her for the presentation is Dr. Betsy Shapiro, who's the Director of Practice Management Resources and Strategy at the American Dental Association. After receiving her dental degree from the University of Illinois, Dr. Shapiro practiced general dentistry for 15 years in a rural Illinois community. Post-practice, she returned to school and earned a Juris Doctorate from Northern Illinois University's College of Law. And then after completing law school and being admitted to the Illinois bar, she was fortunate enough to be awarded the Hillenbrand Fellowship with the ADA. Dr. Shapiro arrived at the ADA in September of 2011 to begin the fellowship. And the ADA likes her so much that we have refused to let her leave, and she continues to work here at the Practice Institute. And so we appreciate her every day as well. With that, I will turn it over to Betsy and Suzanne.
Thank you, Bill. Betsy, thank you so much for joining us today. I know how busy you are in your role over at the ADA, and I appreciate you taking time out of your schedule to have a conversation with me regarding staff management during a transition.
Oh, well, thank you for inviting me. I have to correct one thing that Bill said. He said the ADA liked me so much they kept me. It's just, I never turned in my key card. No one has noticed. I was only supposed to be there a year, and I just kept rolling. But I really appreciate the opportunity to meet with you and talk about this topic. It's an interesting one, I think.
Well, thank you very much, and I know how hard you work, so nice try. But well, what I've been doing over the last couple of years is I've been having a lot of conversations with our owners who are contemplating the sale of their dental practices. And I often hear that they're extremely concerned about their staff, many of whom have been with them for decades. And, quite frankly, they're more like family than they are employees. They want to protect them, and they want to protect their jobs if at all possible. So, Betsy, I've had dentists ask me what they can do to ensure the purchaser of the practice will retain the team members. And in fact, they often want to write provisions into the purchase sale agreements. So my question to you is, what are the buyers and the sellers' respective responsibilities towards the staff members in a practice sale? And can the seller protect the jobs or the salaries? And what is the buyer's responsibility? Can they be contractually obligated to retain the staff?
Well, before I dive too deeply into this, I'll give my standard disclaimer here, because as Bill indicated, I'm a lawyer as well as a dentist. I'm not giving specific legal advice here. I want to be really clear about that I'm just here having a conversation with you. I would always advise anyone, if I'm talking with them one-on-one, to consult their lawyer. Really, and your stable of professionals who are helping you, whether it be accountants or lawyers or practice management transition people like Dr. Ebert here, to make sure you have all your I's dotted and your T's crossed and all that good stuff. So I'll just put that out there, and that goes through all this conversation. So the real truth is, and any lawyer will tell you this, you can write anything into a contract you want about your employees. The problem is it's not going to stick. It's just going to make, it's not really valid. So no, when you sign a contract, or when you have a contract to sell or something like that, what you can do is do your best beforehand to talk with, have a good philosophy, a sharing philosophy, try to work through things like that. But the contract for sale is only between you and the buyer. You can't contract other people's rights and responsibilities into that. It's just not how it works. So what you have to do is you have to terminate your own employees prior to the sale of the practice. As you're approaching that time, you're going to end your contract with them, and you're going to pay them out for whatever you owe them in terms of prorated vacations, bonuses, benefits that are due. Those are your responsibilities as the seller. You want to take care of them. Now, on the other flip side of it, for the buyer, if they want to hire your staff, you should have, as part of your due diligence, talked to the seller about the staff, about their roles and responsibilities, about what's happening in their lives, and you can ask about performance reviews. It's a good idea then to start thinking about having some sort of short-term, maybe working interview, 30 days, something like that, but you're going to set that up as the buyer with each individual employee. You're going to either contract with them, which is a good idea. Some dentists don't choose to have contracts with their employers. If they choose not, employees, excuse me, if they choose not to do that, you should have a very clear understanding. You should make sure they know what you're going to be thinking about in terms of your employee manual, so they know. It's just like a new job interview, kind of. Now, in the bigger picture, how can you protect them? And I understand this entirely. When I was leaving practice, I loved my assistant, and we had been together for almost 14 years at that point. You know, we finished each other's sentences literally often, and I knew she needed her job. I knew it was a good job. I was in a very rural community. It was a good job for her. She had a husband who had health issues. So I wanted to make sure that the dentist who was coming in really appreciated what she brought to the table and was able to stick through the transition. I will tell you, it didn't work out so well. You know, I had talked with him. He had met her. He had observed in the office. He knew a lot of those different things. And they had a 30-day trial, and it worked fine from a clinical sense, but their personalities just didn't really mesh that well. Now, very fortunately, there were 2 other dentists in the office. My particular assistant had been there for a while. She was able to transition into a different role within the practice and not lose anything. But we tried to structure it very carefully and make sure it was a good transition. And in fact, the personalities at the end of the day were the things that were different. So, which is going to happen. You know, I think, Suzanne, you probably have more tales to tell about that from your perspective. I just had that one particular employee and that issue that went on in my life, but it does happen. So hiring as the buyer, just make sure you're clear about your job descriptions. Take a look at what their job descriptions were before and see if they mesh with what you're thinking. Have a clear onboarding process, and then think about that probationary period, because that makes it really easy for each side to just say, thank you, this has been nice, but it's not long-term, and move forward.
Yeah, thank you for that, because that leads into a number of the points that we're planning on talking about today. So you just did a great overview of all of the stuff that we wanted to discuss. One thing that I did want to hit on next, and it seems like a good place to talk about it, and that is the actual job description itself. So because we as dentists coming in, we're not necessarily business people, we're certainly, most of us aren't lawyers. And often we'll come into a situation thinking that everything's going to work out beautifully. And we forget that if you don't have written, clear expectations for people, it makes it a lot harder to make things work well. So all of this, in my opinion, starts well before any closing happens. The dentist who's coming into the practice should always have a well thought out job description for every single role in the office to make sure that the employees understand just exactly what's required of them, both from a qualifications standpoint, as well as what they need to do to satisfactorily fulfill the job requirements. This is really applicable to any business owner. All business owners should have clear-cut job descriptions. And in particular, I think dentists, because that relationship is so key and important, that you really need to be clear about expectations. So, Betsy, I know that the ADA has a lot of great content on job descriptions. So I was wondering if you could just hit on some of the key components, and then maybe we could bring in a couple of those resources that the ADA has available.
Sure. You know, you're absolutely right about having it very, very clearly defined what you're looking for. It's not only beneficial to you as the business owner, as the dentist, but it's really helpful to the staff. They don't know how to meet the expectations that you have of them if they don't know what their job is. And I've known of dentists who have said, well, I expect them to know how to do everything. Well, and that's true to a degree. Most dental offices are small shops, small business shops, and we all help each other out. But you really need to know what skill set you're looking for. You're looking for something entirely different if they're going to be managing your front office and your billing and your dental benefits as opposed to chairside. You know, there's skill sets there that you need to identify. So you're absolutely right, Suzanne. I appreciate you mentioning that the ADA has some good resources on it. In particular, there are two things I would mention. There's a whole cluster of content of educational modules, support modules called Guidelines for Practice Success. And you can find those by going to ada.org/GPS, Guidelines for Practice Success. And they were very cleverly named like that because it's to help steer you toward success. It's like the GPS in your car. So hopefully that makes it easy to remember, but you're going to take a look at that and then look at managing staff, the managing staff module. And I don't want to undersell what this is. It's probably 60 pages of discrete topics about staff management. It has all kinds of samples that you can download, and this is all free for members. In particular to this topic, there are sample job descriptions for different, you know, hygiene versus chairside versus front office staff that you can take a look at for suggestions on what you might think about and what you might be looking for in your particular situation. And it also goes through, you know, considerations for advertising for those, going through the whole flow from start to finish of how to do that and thinking about what questions you can ask. The other thing that you might want to look at is there is and this one is for sale actually, but it is a great resource. I had it when I was in practice. It's gone through many iterations. I'll clue you right in. There's going to be a new one coming out at the end of the summer, so you might want to wait to buy it if you decide you want to buy it, but it's frequently asked legal questions. And in the frequently asked legal questions, it covers not just staffing, it goes A to Z. Right now, there are 328 frequently asked legal questions. That is, in fact, part of the title. I thought that was a little quirky, but our legal staff, and I'm not actually part of the legal staff, is a little quirky, so it works fine. It's a good fit for them. They talk a lot about the different things you need to think about in terms of hiring and firing and all those good things, the legal ethical issues that creep into there. You want to remember to check your state Dental Practice Act. If you're hiring for dental hygienists, you need to know if dental hygienists in your location can administer anesthesia. Now, maybe that's not important to you and you don't need them to do it, so you don't have to worry about it, and do they need to be supervised all the time? Or, you know, can it be a different setup? So look at that Dental Practice Act because you're the one responsible for whether or not they have the correct educational requirements to do whatever it is you're asking of them. So there's some pictures. Yep, there's creating and updating an employee policy manual. That's all part of it. You can look to your policy manual sometimes for a little bit of guidance if you're struggling yourself. You think, okay, these are all the different things. Which ones fit into this job? And then position overviews. That's what I was mentioning from the Managing the Dental Team module of the ADA Guidelines for Practice Success. So do you want me to talk about a staff manual a little bit too at this point, Suzanne? Or
if you want to hit on the highlights, I think really just the importance of having one and knowing where to find this information is great.
Yep. So yeah, there is this staff manual that has all of this. You'll also see that in the guidelines for the Practice Success Managing Dental Team, there's a sample checklist in there. You can take a look at that, and it goes through everything from employees, new employees, reading it and signing it to say, yes, I'm starting this job and I understand these are the policies, which is very important, particularly so if you do not have an employee contract. I would tell you, I failed to mention this earlier, but if you're wanting to do your employee contracts, which I would recommend, look at that saleable content from legal, the frequently asked legal questions. They have sample contracts, sample employee contracts in there. But to the employee manual, acknowledgement, description of your office, diversity and non-discrimination policies. There's a lot of legal things you have to think about, and you should have all of those spelled out in your office manual just to have a good transition, solid team. Everyone's on literally the same page for that. So take a look at the GPS module, download that checklist of things you should have in there, and I think you'll find it very, very helpful.
I have to tell you, Betsy, I refer our owners and our incoming doctors to the GPS series all the time. I'm not going to say I've read them all cover to cover. I believe there are 8 of them.
Yeah.
Yes. But I've read a number of them and gotten new information every single time. So everybody who's on here should take a look at that, especially being free. I wish I would have had those available to me when I was in practice. It would have made my life so much easier in a number of ways.
I would tell you there are so many things in there that now, even though it's my responsibility to have oversight, sometimes I forget we have something in there, and I'm pleasantly surprised. Oh yes, we do have that. So yeah, we have, as I said, the job descriptions are in there, samples are in there. There's a skills and attributions inventory checklist, which helps write job descriptions too. It talks about office administrator. What kind of skills do they need? And is the person who's on your probationary period right now, do they seem to have those or not? And is that a problem because do you have it? Is it your strong suit? Or if you're hiring, do you need to hire someone to fill in your inadequacies? I had to hire someone with computer skills because back when I was starting, that was not a thing I had at all. And in fact, they kept me away from it, except I knew how to print out my daily reports and my budget, but
well, Betsy, let's talk a little bit about that, actually, since you brought it up.
Yeah.
Yes. You've been through a number of transitions in your career. You've been, dentist, lawyer, ADA, specialist in everything. I would just like you to maybe share with our group, what was your experience as a new dentist? And I believe you entered the practice that you stayed with for a number of years right out of school.
Right.
So that can be a really difficult transition. And how did that go? How did the staff help you, hinder you during that particular time in your career?
Well, there's even a little more to the story. So my father was a dentist in this small town in which we grew up. He passed away very young. I was in high school when he passed away. But I had worked in the office first for him, and then after he died, I worked for his 2 partners, cleaning the bathrooms. I'll be very frank. I cleaned the bathrooms. I filed records. I typed dental benefits forms then, because we didn't have very many. It's mostly a farming community. A lot of them didn't have dental benefits at that time. I came in after school, take those, did all that stuff. So most of the staff, when I got out of dental school and came back there, I had worked with them, but I was lowest on the rung. I ran to the grocery store when we were out of whatever it was they wanted back in the break room or things like that. And now suddenly I was coming back in as a dentist. And I came in as an independent contractor, which is not too common, actually. We see a lot of associateship or employment agreements, things like that. I came in as an independent contractor. I am now looking at it from the legal perspective, and I would tell you, don't do what I did, because my contract was literally 1.5 pages, and that second half a page was mostly our signatures. We were very, very, very vague in how this worked, but I had a good relationship with the 2 dentists. I had worked for them in high school, so I knew the nature of their character, and it did work out for me. However, being at the ADA, I hear more and more stories, and Suzanne, you hear boatloads where they don't work out so well. So I think you might have 1 or 2 that were a little uncomfortable. Anyway, I ended up staying there. And the intention was that I would be buying in at some point. But it worked out as an independent contractor. I hired my own staff. I set my own hours. I had my own patients. And the staff relationships took not an entirely long time to shift over, but there was a little bit of a challenge at first. And clearly I was the junior doctor, and I was a woman, and they had not had a woman dentist out there, and this was in the 80s. But my dental school class had 11 women out of 126. I don't know how many you had. So I had grown up in the town. That helped a little bit, but I just had to, I needed to be firm as the leader of my team, who was one assistant, and then the other dentists had to respect me as a dentist, and that's what it took to turn that ship. And as I say, it wasn't particularly challenging. It became a little bit harder down the road when I participated in management decisions, and I had to fire people who had once, who I had once reported to in the feed chain there. That was a little bit of a struggle, but that's how it works out. Ended up having some disability issues and left and went to law school, and then, as I say, came to the ADA. So that's sort of the flow of all of it. I did not buy into the practice, and we can talk about that later if we want to or not, but it worked out for many reasons from that aspect for me.
Well, I'm just going to share a little bit about my story at this point, because I had the unfortunate experience of my entire staff leaving the practice within the first 45 days following the sale.
Wow.
Yeah. And these are longtime staff members. So there were many extenuating circumstances that were involved, but the primary factor, I believe, in my staff leaving was that the new owners and I just had incompatible philosophies of care. The new owners had a very different idea of what the relationship between the doctor and the staff looked like than I did, and it resulted in my staff being somewhat confused. And they automatically assumed that the new owner was harsh and somewhat uncompromising. And I hate to even say it, but there was one staff person in particular that I believe actively worked against the new owners and contributed to the ultimate erosion of the patient base.
Yeah.
And I have to tell you, it's one of the primary reasons I'm so passionate about ensuring that a dentist who's coming into a practice share a compatible philosophy with the other doc. I just feel terrible for the dentists who purchased my practice because it ended up closed within 5 years. And that was, tragic, for them, and that they lost their investment, and for me, who had to experience running into my former patients at the grocery store.
Yeah.
And the question that they would always ask me is, why would you sell to somebody like that? And of course, not being able to respond, it was very difficult. So I've just always wondered if the outcome would have been different if the buyers, had been able to get the staff on their side. And, even further, I had to sell my practice. My practice sold fairly quickly after I made the decision to sell. And I sold because of some health problems. And I just wonder if I had gotten the staff involved in the process early and not had that secretive mindset that I thought was just the way it was done,
Mm-hmm.
I wonder if things would have turned out a little bit differently. So, what I feel is my story really illuminates how influential the staff can be during a transition of ownership. And it seems like now a good time, to talk about the things that you can do to make that transition process go a little bit more smoothly. Just some concrete tips, things that you can do at any point in your dental career life, but certainly when you're looking to bring somebody on. So let's start with some of those tips. Because let's face it, one of the biggest reasons the staff is reluctant to accept a new doctor is that they feel kind of a loyalty to that senior doc. And in many cases, the staff has been with that one dentist for decades, and new ways of doing things aren't very comfortable. So why not take the time to show the staff that there's more than one way to arrive at a quality outcome? And one way I like to encourage docs to do this is to have a joint treatment planning session. In this case, a senior doc would pick a complex case, and preferably one that everyone in the office is really proud of. You know, you have those cases where you're just, this was a great outcome. But it would be nice to look at that with a fresh set of eyes. So why not have the two doctors sit down with the staff and discuss maybe a different way to tackle the case? What we want to see is the staff seeing the doctors interacting, bouncing ideas back and forth, and the staff should be encouraged to talk about it. They should be encouraged to see maybe what a new way of doing this, how it would affect the patient's outcome. Maybe it would be more efficient in time or materials, or maybe the patient could have been saved some money or even some post-op discomfort. Ultimately, the goal of an exercise like this is for the staff to see that there's more than one way to achieve that high quality result, and that the new doc is just as interested in achieving that quality. So there are some other ideas that might be a little easier if you don't want to do these kinds of interactive sessions. You know, every dentist undergoing a transition should set short and long-term financial goals. And why not reward the staff when those goals are achieved? So this could be something as simple as a gift card for a short-term metric being made, or, you know, depending on your situation, if you feel comfortable with it, you know, go for a staff trip. Team building excursions can be worth their weight in gold for getting an entire team to work together. Obviously, never do more than you're comfortable with, but everyone likes to be appreciated, and let's face it, the staff plays a huge part in your overall success. The obvious things are keeping the lines of communication open and clearly defining what you expect. Now, here's one. When you see warning signs, do not ignore them. Next slide, please. If you see an assistant showing up late to morning huddle every morning, you know, especially if that's when the staff assignments are made, or you see that your schedule is booked solid for 4 or 5 weeks, but the associate has all these openings. And when you question your front desk staff, they say, "But doctor, none of those patients wants to see anyone but you." Okay. That's not contributing to the overall health of the practice. It's your responsibility now to discover whether the problem lies with the dentist or with the staff. Meaning, are they unhappy with the situation because they're working extended hours, or they just don't really understand how to transition a patient? Or are they unhappy because they see a quality of care issue and think that they are protecting those long-term patients? Again, I'm going to hit it, I'm going to say it again. Do not ignore this situation. It will not just go away on its own, as much as you may want it to. You have a responsibility in this scenario to check the associates' work quality and examine their interactions with the staff and the patients to ensure that the problem does not lie with the dentist or the quality of care that's being delivered. But if you determine that the problem lies with the staff person, and you've done everything that you can to get them on board with the changes that are occurring in the office, and you're not having any success, you may need to cut your losses on this particular person. None of us want to be in this position. But if you find yourself here, make sure that you do it properly. And Betsy, I'm going to ask you, after the probationary period is over, because then it's pretty straightforward. It's just not working out. But how does a dentist go about terminating an employee the right way, and what resources do we have available to help them?
Carefully, thoughtfully, and I would add, as humanely as possible, but in a business-like manner. So those are non-legal tips. And remember, I'm not giving you legal advice here, but you should, of course, it's the number one thing for anything in risk management: document. You should have had, I would say, unless there's something totally crazy that happens. And I can tell you one from my practice. We had a staff member who wasn't a very pleasant person, but she was back office, did her own stuff in her own, did a lot of the dental benefits, all that stuff. She didn't have to interact with people a lot, which she was good at what she did, but she got angry with one of the other staff people, pushed them over, and then kicked them while they were down. So that one was like not a pre-planned termination, but it was quite clear. Yeah. The crazy things that you never think you'll have to deal with in your life. However, generally speaking, that is not how these come about. They come about through all the things that you just noted, Suzanne. You start to see changes in behavior or poor performance, and you should be talking with them about this and documenting these conversations. Performance reviews once a year are pretty tough to hang your hat on. And as dentists, we tend to be people pleasers. We like to say nice things. And so we say, oh my gosh, you come in every day, you look professional, you are pleasant with the patients. I love that. You failed, but not always coming in on time. So could you work on that? That's the undertone little voice, and you don't really write it in your record, but you need to start keeping, if you don't already, keep employee records and document your performance reviews. So it shouldn't come as a shock when you're getting to the point where they haven't met the expectations, because you've been saying to them in their course of behavior, this is what I need to see. So then it's easy to say, I have not seen this. So document it. I would advise that you talk to your lawyer, or and certainly contact your professional coverage companies, to make sure everything is good. There are some things you need to be really careful about. The Americans with Disabilities Act and the discrimination laws can impact firing situations. That does not mean you cannot fire someone who falls in, who has a disability. You certainly can, but you have to fire them for the right reasons. It has to be that they couldn't perform their job, that they knew the job expectation going into it, that you've made the reasonable accommodations that they needed to perform their job, those kinds of things. But be very careful that you're doing that. You want to keep your employment, your meeting pretty short, stick to the business. And then there's a whole host of other things, in terms of like getting any keys they have, changing passwords, whatever they need to do that. But you can find some pretty good resources for this. If you want to go to that next slide for us, please, Kathleen. So there's a checklist in the Managing the Dental Team. It's this module that's online. It's free for our members. Again, I keep harping on that, but it's really a great resource. So it has a checklist for terminating employee that goes through the steps of what you need to be thinking about. There's some content in there, just written content, that talks about terminations. And also there's another module that's professional risks. It addresses managing professional risks. And it talks about those things like being aware of any laws, fair labor standards or anti-discrimination things, or protected classes that you need to think about and make sure you have your ducks in a row as you go in and prepare to fire to let someone go. So, keep it professional, keep it short, stick to your script. I would always suggest you practice ahead of time in your head or out loud with someone that you trust. Generally speaking, this should be done privately. You might consider having either your lawyer or if there's another dentist and one other person as a witness, but it shouldn't be a peer staffer of this person necessarily. That's not usually a really good idea. Most offices then become they're a little too collegial, and that conversation goes around, and that's not helpful for anyone, and it doesn't help the staff person who's being let go maintain their dignity, which we'd all like this to go as smoothly as possible if we can. Makes it a better run for everyone.
Yeah, one of the most difficult things I think that you do as a business owner is letting somebody go. It's incredibly difficult.
Just a practice pointer from my own life. And I learned this from the senior partner in my practice, who was a great business manager. He said to me one time, he said, if you can encourage them to leave on their own before you have to fire them, consider that thoughtfully. And I will tell you that has served me well in life, in your performance reviews, as you're saying, you're not meeting this expectation, you're not doing this, I failed to see this, it seems to me like you're not happy. Are we the right fit for you? Are we the right fit for each other? And that, frankly, starts them thinking about, maybe I should be looking, because really they don't want to be fired. They don't want to have that on their resume or have to explain why they left their last job, or have their next prospective employer call you for a reference, or you not be able to, so try to finesse that if you can, and then you save yourself a lot of problems. So, and unemployment taxes going up. So
yes, it's, having been in this position a couple of times throughout my career in my different roles, it's always a challenge. The one thing I will go back to is we can try to encourage people to leave on their own, but don't do it by ignoring the situation. That is the worst thing that you can do, I believe, in this situation. It's just so difficult. So
yeah, it doesn't go away.
No, it doesn't. It doesn't.
It makes it very difficult because the other staff know as well. I mean, and they're looking to you for leadership, and you're setting the expectation. And if you're letting things just disintegrate a little bit on one side, it becomes toxic all the way across. So,
yep, that's exactly how I've heard it termed, and toxicity in the office.
Yeah, not a good thing. Toxicity actually isn't really good anywhere.
No.
Maybe it's Botox and you've got a wrinkle, but otherwise, not a fan.
Okay. Well, Betsy, in our final couple of minutes here, I would like to switch gears a little bit because I want to address a very different type of transition. And that's one that many of our doctors are experiencing right now. And that's the transition of staff back into the workplace following a COVID-19 closure. And Betsy is one of the folks on the front lines over there at the ADA. I know that you have some great insight into some of the common scenarios that our doctors are encountering. And I personally have seen from colleagues everything from, my staff is refusing to come back to work, to, this one kills me, my staff wants me to pay them under the table so they can continue to collect their unemployment benefits. So I'm going to pass this one off to you and ask if you can just comment on those and some of the other issues that you are encountering.
Sure. So the first and foremost, let me tell you that this whole COVID-19 pandemic has produced the most incredible amount of monitoring and change and updating of anything I think the ADA and every other industry in the world have faced. So what I say today might be changed tomorrow, depending on what comes out from our federal government. what the trends are with the disease patterns, all of those things. So first and foremost, ada.org/virus. We post everything up there. We update it. There's something updated there daily. Yeah, thank you. It just changes every single minute of what's happening in there as to what's exploding in the world. And there are some great resources on there. There's a video on, if you just ada.org/virus, and then look at digital events, and there is an employment law firm who answers questions, frequently asked questions, and you can get some really good advice there. And they're talking about the things you need to consider about why an employee isn't coming back. So is it because they are sick? Well, then they have certain protections under this, and you need to take a look at that. And different states, different jurisdictions have different rules about how they're handling that in terms of the staff being paid. So take a good look. Often your own state dental society is providing supplements to what we have that are state specific for you. So I would encourage you to look at those things. But if the patient is sick, or if they are if the staff person is sick, or if they're caring for someone at home who has COVID-19, you need to keep their job open. There are different methods of paying them under, it can be long-term disability, short-term disability. It can be with workers' compensation, if indeed it seems that they got this from their workplace. Now, in Illinois specifically, they talk about almost everything is considered to be workman's comp if they come up with COVID. It doesn't matter. You have an argument if your office has been entirely closed, and you can say, no, they weren't working, but, take a deep look at that. If it is that they are asking you to pay them under the table, which I have certainly heard, or only have me work X hours so I can still get my unemployment and, hire a temp for the rest of the time, that puts you at liability. You're performing an illegal act. And is it worth it to do that? I would suggest it is not. Not at all. It's not ethical, and it's not legal. In terms, you could, if you wanted to, structure your schedule so that they worked far fewer hours and either hire a temp or you cut back your production if that's what you feel is really necessary to keep a star performer. But in the long run, is this really the kind of person you want on your team if this is what they're asking of you? And if so, if you really want them, think about other ways to maybe do that. Is it possible? Is it, right now we're under a nationwide, there's a $600 bump up on the unemployment benefit, which is what's putting many people into a higher salary bracket, many dental staffers into a higher salary bracket than they were before. So perhaps you consider offering them some type of incentive to maybe not meet that $600, but, for the next July 31st right now, and till that period of time, you'll bump up their paycheck. You have to figure that out for yourself based on the value this person brings to the team, where you are, but you can make the decision that maybe now is the time to terminate. If what I have seen in the phone calls that have been coming in when I'm talking to members, generally speaking, when it is a staff person who's asking them to do that, I ask the dentist to think about, is this a staff person you want long-term? And very often there's a long pause and they're like, well, no, I guess not really, but I hate to have one more change during this. Like, well, maybe look at it as a gift. This is the time to reconsider your staffing needs or your positions, and you could make that choice. So think about that, take a look at that. We're getting a lot of questions about staff members testing positive and how to handle that. So there are some resources on the ada.org/virus. Under the practice tab, you'll see there's little tabs all the way across practice resources. It has a nice little handout that just says steps to take if a patient reports COVID-19 exposure after treatment, and steps to take if a staff member tests positive. There's a whole toolkit in there if you haven't already seen it. And I know it was one of the things we put out right at the beginning. 120,000 folks have seen that toolkit, so chances are good you have. But if you haven't, go in there and download it and get it. It goes through everything from the start of a patient to the end of the day, but it talks about how you can work with your staff. You can screen your staff every day, and you should take their temperature, take their, ask them if they have any symptoms, just as you would a patient coming into your office, ask that of your staff. Some staff are not wanting to come back to work because they're concerned about the PPE that they've got. They think it isn't suitable. This is time for you to have a good conversation and engage them in what are the best practices in your office? What is the risk level? How are you going to mitigate that risk? We all know in dentistry, there's always risk. There's been risk since tuberculosis was around, hepatitis, HIV, swine flu, you name it. We're prepared for risk, and we can get through this, but some staff members will be a little bit more hesitant, a little bit more uncomfortable. So have a conversation with them about why, and then sit down and talk through what you see and what you're doing and how they can help, and try to come to a good place. If you feel comfortable, you should be able to communicate to your staff the good reasons why and help them feel more comfortable. There is another tool in that ada.org/virus. It's a hazard assessment. It's designed on the OSHA requirements. OSHA is only concerned with protecting your workers. They don't care about your patients and they don't care about you. They care about your workers. And so this goes through how to assess what the particular hazard risk is in your area and in your office and with your patients. So talk through that with any worker that is uncomfortable and see how they're feeling at the end of the conversation. And then, hopefully move forward. Hopefully have everyone feeling comfortable and go forward. We are seeing a lightening up of PPE sources. There's more coming around. ADA members are being given the opportunity to get some KN95s from the ADA just for the cost of shipping. So take advantage of that if you haven't. And I know we will all get through this. Please know the ADA is there to try to help you get through it. You can always reach out and ask a question, and we'll see if we can't find you an answer if it's not already there, but take a look there first. So anything else?
The one thing that I hear repeatedly, Betsy, and this is something maybe you can just address quickly. I hear doctors say, do I have to have my staff sign some kind of an agreement to not sue me should they contract COVID? So can you just touch on that? Because I hear that, I cannot tell you how many times I've had that question.
Yeah, you really can't, you can't sign away your rights for protection under the law. You can't say, I promise to never sue you, because maybe there's gross negligence. And, maybe the doctor is saying, well, you know what, wait, the warehouse mask never delivered, so we're just going to practice with a face shield today. You're going to be fine. You can't have them sign that kind of a statement. Well, as I said way back at the beginning of this, you can have someone sign anything. Will it hold up? No. That's the difference on that. So what you really need to do, and what I really encourage is what is key to every single topic we've touched on: communication. It's very, very challenging to know where anything with this disease, where it comes from. We've had, so far, it's all been good news on the front of transmission within a dental office. We're not seeing, I shouldn't say we're not seeing any cases, because there is a particular office that had I think 5 employees, but interestingly enough, those 5 were at a social event that ended up being a source point for contact tracing. The other employees and the dentist in the office were not at that social event. They did not test, and still have not tested positive, which speaks to the methods of the protection in the office, they were all working together, presumably while the 5 who got it were pre-symptomatic. And none of those others who weren't at the social event got it, but there was this, oh my gosh, this is an explosion in an office. But as they started tracing back through the public health, they discovered, no, they were all at a party. It was a social event. They weren't quite as careful perhaps, or everyone's using the same pitcher handle and touching it, and then, wiping their eye for a second, even if they're wearing masks or not wearing masks. And so those ones picked it up there. The office stayed safe. As I said, we're historically pretty good at this. It's been our nature forever.
Yep. And one of the things, we're a very small group of highly trained professionals. We're going to come through this okay. And
we are.
I personally have been on ada.org/virus probably every day since this has started. So I appreciate all of the time and effort that's been put into it.
Yeah. One more quick note I will just say, because you asked me about employees and making them sign. You also cannot, the testing, you can't mandate antibody testing for your staff. You can antigen once that, for an antigen test. And if we all remember our coursework back in time, antigens indicate the presence of the current status being infected. Antibodies are you've been exposed to it, and this is down the road and you have the antibodies. You cannot ask them to participate in a mandatory antibody test. I have no idea why that came out, but that came out from the EEOC, that antigen testing, fine, antibody testing, not allowed. You can ask them if they voluntarily go do it. That's great, but you can't tell them they have to.
That's, again, it changes every single day, right? The different information.
Right.
It looks like we only have a couple of minutes left. As usual, Betsy, when you and I get talking, we tend to go over a little bit, so I'm sorry about that. Bill, I'm going to turn this back over to you for any outstanding questions or comments.
Absolutely. We are right coming up on the time, so we're going to be respectful of everybody's time. Thank you so much for joining us, and thank you especially to Dr. Ebert and Dr. Shapiro for some great information and some great resources. And we are here ready to serve in any way that we can, both at the ADA and at ADA Practice Transitions. Thanks once again for your time, and have a great day and a wonderful weekend. Goodbye, everybody.